So this is interesting. This morning we are shedding light on something you may have never heard of before. It's an abnormality in the eye that affects young people going through puberty or those in their late teens. Dr. Eric Fazio is back from Newsome to give us some insight. Good morning.
Thank you for having me again. Thank you.
We love when you and your team are here. Again, kind of this thing of Newsome. This is the brand that people know, they trust. You guys are kind of really putting yourself in the forefront, I think, of technology, certainly when it comes to eye care and eye specialties. And this is the perfect example of that. Talk about what this abnormality is that we're going to talk about this morning.
Yeah, it uses some difficult words, but the disease is called keratoconus, and it's an unusual abnormality that the simplest way I could describe is it causes like a hernia of the front of your eye. So the front of the eye is actually responsible for probably 2/3 of our vision. We don't realize that, but if you go in the pool and open your eyes, can you see? No, because the cornea is not working right. So if it's distorted or herniated, believe it or not, regular glasses and contacts don't fix your vision.
Wow. Well, and you say it's somewhat rare, but you said there's actually been a lot of people here in the Bay Area that have reached out to you. One, because again, your team is one of the few in the country, I guess, that's doing the kind of treatment for it. Is there, kind of explain what the treatment is? Yeah,
I mean, that and statistics are all over the place, but it's about 2 in 1,000. But what's interesting is we do a lot of LASIK. So when you do a lot of LASIK, you're screening corneas because you're operating on that tissue. And if the tissue is abnormal, you can't do the surgery. So it's an exclusionary thing. So you start seeing a lot more when you're a LASIK center. We're a pretty busy LASIK center, so we see a lot more, patients. And I think the incidences are fairly low in the country because it's very hard to detect. But one of the problems is it starts very young, and patients don't have a lot of symptoms. They just know they can't see well. They go to the doctor may or may not diagnose it. That's another problem. And then they start wearing glasses and contacts, but eventually they just don't work.
Is it better if you catch it early? I mean,
absolutely. And the reason it's important that you catch it early because this procedure is really groundbreaking. What it really does is it strengthens the cornea about 300%, which is huge, and about 98% of the time can really halt the disease.
Wow.
So it's really a remarkable change in what we could do, which was really not much of anything. What traditionally we've done with these patients is kind of wait them out to do then a corneal transplant, which is a very serious surgery. So they can get scarring, honestly, even perforation of the cornea. It can be a terrible thing if it progresses, and it usually does. So it can start young, which, if you can imagine helping someone with vision at a young age and stabilizing it for the rest of your life, that's a huge thing. Well,
and my first question to you, too, was talking about if it's young and when kids are in puberty. I mean, is it hormonal? But not necessarily.
It's not hormonal. They've done a lot of studies. There's a genetic link. I know, unfortunately, I have it in my family, so I'm very familiar with the disease. One of my cousins has already had a transplant from this. So I'm very intimate.
How's he doing, by the way?
He's doing pretty well. He's doing very well. But it's something that's a little close to my heart because of that. So, we really need to do something to prevent that. And that's really what the goal is. And this really can do it. The problem is with this procedure, there's costs involved. The FDA has been on our way a little bit, and Dresden, Germany set up the protocol, believe it or not, back in '98. So around the world, we've been seeing this. So at Newsome, me and Hunter kind of looked at this, and Dr. Grudas, our cornea specialist, said, we need to do this. So we actually set up an investigational research study to be able to do this. It was very tricky, all the loopholes and red tape, but we managed to set it up, and we're knocking it out.
That's what you need is doctors and a team who's passionate about this, who want to see kind of things move forward and actually do something about it.
And it's very, sorry not to cut you off, but it's very, very simple to do, believe it or not. So it uses a vitamin called riboflavin. You just got to soak the cornea with the riboflavin, and believe it or not, you use a UV light to activate it. It's really that simple. What's different with what we do versus what the FDA is kind of looking at is we don't scrape off the front of the eye to do it, which is called epi-off. I don't want to get too technical. We leave that intact, which is unique within our study. And that really changes things a lot. We upped our energy of the UV, which cut the treatment from 30 minutes to 5 minutes, which doesn't sound like a lot, but if you want to sit on a table for 30 minutes with a light blasting in the eye, it's a lot.
Well, and as we wrap up here, I mean, I think this is just a perfect example of how your team really is kind of cutting edge and really moving, this specialty kind of forward. If someone's watching at home, they want to, whether it's something about this or something else, best way to do, come in, call.
Yeah, call our surgical coordinator, Devin. She's coordinating all this. She's awesome. She does all our LASIK as well. We're really excited. I'm very excited about this. This is something we want to do, and we want to do it big.
All right. Thank you so much, Doctor. Again, we appreciate you spending some time with us today.
Thank you.